Did you know that some types of urinary incontinence are reversible? We'll talk about it today on The Wrinkle. So you know, in medicine, we love acronyms. We like to have a little mnemonic that we can kind of remember that helps us remember the causes of things or a disease or something like that. So believe it or not, we have a mnemonic for reversible causes of urinary incontinence. And this one's really cute. It's diapers. DIAPPERS. And it's a good way to remember what are some reversible or potentially treatable causes of urinary incontinence. So the D in diapers stands for delirium. We've talked about delirium before. It's a reversible, sudden change in brain function that leads to a lot of confusion, sometimes excessive sleepiness, or being very hyper. And when delirium happens, it's not uncommon that someone has urinary incontinence along with it, really just because they might be too drowsy or too confused to use the toilet properly. So when the delirium clears, usually the urinary incontinence clears as well. The I stands for infection, which is a very common cause of worsening or new onset urinary incontinence. Often the other symptoms of infection are things like a foul odor to the urine, or burning, or having to go pee much more often. So if that is what someone's experiencing, it's worth checking a urine sample to see if there's an infection. The A stands for Atrophic Vaginitis. So this is more common in females when there is sort of a loss of elasticity to the tissue that is in the vagina, and that can worsen incontinence. That's also treatable. So often we can use topical creams that can sort of soften the tissues and help the incontinence problem. The first P is pharmaceuticals. So there are lots of drugs that can worsen urinary incontinence. Have you ever heard of water pills? Well, they make you take off water by going to the bathroom more frequently. So just about any kind of water pill or diuretic can worsen incontinence. But there are others too. There are certain medications that are anticholinergic. So they might actually cause urinary retention and then cause you to dribble. It's a mechanism called overflow incontinence, but basically those medications can cause incontinence too. The other P is psychological causes of incontinence. And that can be things like depression or dementia, major neurocognitive disorder. It seems unusual, but when people are experiencing a severe depression or when they are getting cognitively impaired, their continence might be affected and they might have more difficulty staying dry. The E is excessive urine output. You're probably saying, yeah, excessive urine output, isn't that what incontinence is? But we use that E to kind of stand for other things, other medical conditions or things in the blood chemistry that can cause excessive urine output. An example would be if a person has diabetes that isn't well controlled and their blood sugar is very high, this can cause excessive output of urine. Some metabolic conditions can do that too. Another thing is if a person has congestive heart failure and is having difficulty with regulating the amount of fluid that's being pumped by the heart, they can have excessive urine output. Usually along with that, there are other symptoms. But as those conditions are treated, the urinary incontinence often gets better as well. R is for restricted mobility. Oftentimes people have difficulty getting to the bathroom, and that could be for a temporary reason, like if you have a cast or if you're in hospital and you've been told to stay on bed rest. But when the mobility improves, they should be able to return to their previously scheduled bathroom visits. And the last one is stool. When we're thinking about the bladder, we don't always think about the bowel, but bowel status can affect your bladder. If somebody is very constipated, if they have hard stool that's what we might even describe as impacted, it can actually put mechanical pressure on the bladder and create that, again, that overflow situation where the person's bladder becomes distended and then a little bit of urine dribbles out. So it's important to make sure the bowels are moving if we want to address urinary incontinence. One thing to remember is that if you're experiencing urinary incontinence, the causes that I'm describing are treatable, but even when they're treated, they may not reverse the situation completely. Many people are living with incontinence on a chronic basis. And if you are one of those people, you're definitely not alone. The main thing is that we're hopeful that living with incontinence doesn't keep people indoors, and that recognizing that it's a common problem, it is treatable. We want people to still get out there and live their lives, whether they have urinary incontinence or not. Are you getting enough wrinkle? Let me rephrase. Are you getting enough of the wrinkle? If you like this video, please hit the thumbs up, and if you didn't, give it a thumbs down, but please hit the subscribe button and the little notification bell, and that way you'll never miss a video. We do upload twice a week, and we have our Jerry Minute on Twitter and Facebook twice a week as well. All the links are below. I'd love to hear from you. Please leave a comment, and I'll see you next time on The Wrinkle.